Okay, so acute leukemia is an accumulation of immature cells or blasts. They're either going to be myeloid or they're going to be lymphoid. In an adult, if you play the odds and strictly play the odds, you should guess myeloid always in an adult because myeloid is much more common in the adult population. Lymphoid is what the kids get. When we talk about acute leukemia, we talk about both of those subtypes, myeloid and lymphoid, and you can see there are some distinguishing things between the two. Myeloid cells, if we stain them or when we stain them, are going to stain positive for a stain called Sudan black or myeloperoxidase or esterase. When you look at a myeloid cell underneath the microscope, you may see aurons, you may see granules, and you typically see more nucleoli than not. So you may see 2 or 3 nucleoli in the cell. So more nucleoli, granules, aurons, and then those stains. If you look at a lymphoid blast, it may look a lot the same, but generally has fewer nucleoli and stains only with PAS positivity. What is that? That is an aurod, okay? If you see that, you don't have to do anything else to this. This is myeloid without a doubt. You don't have to do anything. We do other stuff, but you don't have to. You know that this is a myeloid acute leukemia, okay? So if they give you a stem or they give you a picture and they show you an aurod, go for it. It's myeloid, okay? This is a Sudan black stain, and you can see it descriptive. So this is the cytoplasm, and it's all stained. Those are all granules in the cytoplasm, and the granules all stained with the black stain. This is a PAS stain, so this is what the lymphoid cells stain with, and you can see that kind of bright cherry red staining around these blasts, and so those are lymphoid blasts. Okay, so acute leukemia. Typically going to present with an elevated white count, although occasionally it'll be normal or low. Typically it's elevated. Typically those patients are also going to have a concomitant anemia and a concomitant thrombocytopenia because the marrow is now full of immature cells, and so there's no room for the other cells to be there. A lot of times when they will present with some infectious sort of complication, although they may present with anemia or thrombocytopenia symptoms. When you work up somebody that has an acute leukemia or that you suspect for acute leukemia, what you need to do is initially is their bone marrow aspirate and biopsy. That's where the money is, and that's going to give you your diagnosis. By definition, you need more than 20% blast to give somebody a diagnosis of acute leukemia. And then you're going to need to do stains, you're going to need to do flow, and you're going to need to do cyto on that in order to give you all the information you need for your patient. The stains and the flow help tell you what